It's just, yeah, it was very, very glitchy in the beginning. It was really, oh gosh, I can't tell you how many patients that happened to. And I would sit at home and just, oh.
So now, what types of things were you seeing? Let's just talk about some of the issues. One of the things I found surprising, and well, I mean, and that we are hearing a lot about, and it's really weird. I've actually talked to oncologists,
Mhm.
one, that I know very well, and others have mentioned this, that my cases, like they all talk about how they know their cases that are in remission, and they know the remission rates and how often, how long those hold and how long they last and what's going on. And I've talked to several oncologists, like, I don't know what is going on, but so many of my patients that are in remission are just, their cancer's coming back like overnight. And one of the doctors I was talking to said, and I just started finally asking, wait a minute, did you get the vaccination? And now they're starting to ask, did you get the vaccination? Because it's throwing all their numbers off. It's making them look bad, right? I mean,
Mhm.
all these cases popping up. So one of the things that I noticed you said is you said you saw sort of a rise in cancer patients.
Yes.
What was it that triggered that? Like how bad? I mean, bad enough you could tell?
Very much so. Actually, one of the early patients that I reported on was somebody that whose cancer came back from remission and rapidly killed the individual. I mean, it was kind of crazy. They I don't know, the cancer was in remission, going about your life, and then all of a sudden, wham, it's back, and it's back with a vengeance, to the point they couldn't get the patient on treatment quick enough, and it killed the patient. And that's happened quite a few times.
Really?
Very noticeable. And not just myself, but even by our oncology colleagues. I actually
Okay.
called one of our oncologists about this particular patient, and he agreed, wow, this could really be possibly related. And it was very early in the VAERS reporting and very early in this
Hmm.
recognition. And since that time, that's unfortunately a very common thing we see. We're also seeing new cancers come out of nowhere, very weird things. Again, that solid organ tumors that we can't get biopsied before they kill the patient.
Wow.
I mean, they just progress so rapidly, you can't even get these patients a biopsy to find out what kind of cancer it was. So the families are left with either an autopsy to determine what cancer it was, or a just unknown.
Wow.
Yeah.
What other things? What about thrombocytopenia? This is something that we heard a lot about with the and AstraZeneca first in Europe and then Johnson and Johnson here. We looked it up. We've discussed on our show. We're seeing Pfizer and Moderna seem to have the same problem. Blood clots, thrombocytopenia. Have you seen any of that?
Very much so. Very much so. Heart attacks, cardiomyopathies, thrombocytopenias, strokes are big ones. Blood clots. Interestingly enough, 2021 is the year that our blood thinners no longer work. Um,
Wow.
it's amazing. We've had quite a few patients that have developed pulmonary emboli as well as blood clots in the legs on full anticoagulation, full blood thinners. And we just look at ourselves like, well, and I actually had a colleague tell me the other day, well, drugs are not 100%. And I'm like, it's interesting because in 2021, a lot of our drugs don't seem to be 100% anymore. It's kind of interesting. And we're seeing some Bell's palsy. I did report a couple of cases of Bell's palsy, a lot of odd neurologic complaints, seizures, people with these weird tremors. It's like they can't control their body. I had a patient recently with that similar complaint. A lot of falls, GI complaints, gastrointestinal complaints, brain bleeds. One of the things we saw early on was elderly people passing out after the vaccine. So they would get their second dose and then go home. They're feeling fine. And then the family would find them on the floor the next day, passed out, hit their head. And to the point where I said, geez, maybe we should be telling people at these vaccine centers, if you got an elderly patient, stay with them that night, because you might
Right.
find them on the floor the next day.
Wow.
So yeah, we were seeing a lot of that. A lot of pneumonias. That's another one.
In the
Sepsis.
middle of the summer, you said. I
Yes,
mean, which is weird, right? I mean, the
it's
summer we don't
weird.
usually, you're not getting the flu, you're not getting
No.
colds, you should be doing the best you're going to do all year, and yet you're saying pneumonia everywhere.
Oh yes, and keeping in mind that in the spring, early summer, we were out of the masks.
Right.
Where I live, we were free. We thought this was over, and yet we're getting inundated in the hospital with people with pneumonia. And we're saying, geez, you're outside. It was a beautiful summer. You're getting fresh air. You're not in these masks. This is very odd. This is very odd.
So you start reporting all these, and there's a phone call we have now. Was this? I think it was with the was it with the U.S. State Department?
The
Oh,
New York State Department